could you tell us a little bit about your sodium bicarbonate treatment? In other words, I know you had said sometimes it's hard. You put a catheter inside to go to the prostate, and it's hard to get to the brain. Oh, not the brain, the bone. So could you tell us a little bit about that?
All, orally sodium bicarbonate is very rarely effective, orally, because it doesn't reach the organs. So now when people takes orally sodium bicarbonate doesn't do anything, first of all. Secondly, if you mix sodium bicarbonate with other substances, maple syrup or lemon or whatever you want, you just neutralize the action of the sodium bicarbonate. This is a mistake. If you want to take, if somebody can take sodium bicarbonate orally, he can take it, and it is effective for mouth tumor and also stomach cancer, and is also effective in liver cancer. But if you want to eliminate quick and definitely tumor, you have to put in contact the sodium bicarbonate with the tumor. So, for instance, if you want to treat bladder cancer, you have to put a catheter into the bladder. If you want to eliminate cancer in the liver, pancreas, prostate, or rectum, you need to put the catheter into the rectal, the artery that feed the organs. Look at this. This is a rectal cancer. You know this. Look how bad is this. Rectal cancer. Okay, sigmoid rectal cancer.
Okay.
We put a port cut with the catheter, two catheters into the groins that reach the rectal arteries. Look after 1 month and a half, the difference. Look at the difference. Clear. Because you could administrate all the sodium bicarbonate onto the tumor with the artery. So it is important to use the artery. Also, you can do this method of the artery on brain tumor. Also, intravenously administration is effective on brain cancer. For instance, but sometimes when the arteries are very, very small, or you cannot put a catheter, you can make also surgery, partial surgery, but you have to use this sodium bicarbonate solution, 500 mils, 5%, during the operation, and after 1 month after the operation, with the aim to sterilize all the roots. This is in the future, all the surgeries will be done with the sodium bicarbonate, because it can kill the roots where the surgeon cuts, otherwise they will spread. Also, for instance, with the catheter, if somebody has a catheter and liquid effusion in the pleura, this is really effective. If you put a catheter into the pleura, 90% blood and effusion will disappear in a couple of weeks. So you have to adopt the right method for each tumor. Catheters, intravenously, operation, port cuts, depending on the location of the tumor. And if you reach it properly, many times you can cure people if the illness is not too advanced, because dead people is very difficult to cure. I had also people that could improve even when they were terminal. For instance, 14 days ago, I went to Romania. I saw a patient in a half coma with a brain tumor. They want me to go there. Few days ago, I was there. this guy was not speaking, but was communicating with us, with his wife. It's unbelievable. Sometimes I can do it, but not always for terminal people. Better to do it before, if there are too many metastases, especially in the plain bone. Metastasis where there is no circulation, this is impossible. There are tumors very difficult to cure. Esophagus cancer where there is no circulation, very difficult. But other kind of tumors, bladder, breast, melanoma with iodine tincture, or neck uterus cancer, they can heal 90%. I have many poor women with the neck uterus cancer. They called me before operation. They called me or wrote to me. I didn't see them. They healed completely on internet or by telephone. Mm-hmm. So it's really effective. We can help people. But it depends on the procedure, right procedure. For instance, for the neck uterus cancer, only with irrigation, people heal. Mm-hmm. And even if you don't know it, you don't know them.
Okay, let me just tell you about two people. This one person is in my book. His name is Vernon Johnson. He had 4th stage colon cancer that spread to his bone. Okay, and then the second person is a person I seen on one of your videos that had uterus cancer. Okay, now this Vernon Johnson, what he did, he was told to go home and put his life in order because there's nothing more that they can do. So he heard about sodium bicarbonate. So what he did, he put it in a 8-ounce glass of water. He put 1 teaspoon, level teaspoon of sodium bicarbonate, and he mixed it up. And he put a teaspoon of maple syrup, and he mixed that up. And he drank it every day, maybe 2 times a day, once in the morning, once at night. I forget how long it was. It could have been 3 weeks, it could have been a month, but his cancer was completely gone.
Where the cancer was?
The cancer was in the colon, and it was in the, it spread to the bone, okay? And today, he has a website. If you, I don't know if I sent you my book, but I will send you the book again, and you look to see what he did. Today, it's over 10 years, he's still alive, and still doing well. Now, the second person was a person that, she had uterus cancer. And I think you had mentioned it, she was on one of your lectures, where she did a douche, a sodium bicarbonate douche. And she cured herself also of uterus cancer. Can you talk a little bit about those cases?
There are many, but the one that the one, I don't know, maybe you think about the French woman.
Yes,
the French
yes,
woman.
yes.
Because there are many. This is significant because she came from Paris, but originally she is Italian.
Okay.
She went to me very scared. They wanted to cut off all the uterus and the ovary and everything, and she told me she had the tumor in the neck. On the neck, she made all the examinations, and they said you have to remove everything. Since she was still a young woman, she wanted to keep her uterus and the ovaries. She told me, everybody is against me. Everybody wants me to make classic operations and chemo and so on. But I want to keep my uterus and I want to continue to hope to have children. So she came to Rome. I explained very well how to do the douches. And after 2 months, more or less, 3 months, she was cancer-free. And she's still alive. She sent me people. There is another woman that was bleeding with not the neck uterus cancer, but the uterus cancer. She was bleeding continuously, and they want to cut off all the uterus. And she made also an interview in Italian interview, and she said, after 6 days douching, as doctor told me, the bleeding stopped completely, and she healed. But I have many other patients. I have also patients. I have also emails. They thank me. For instance, a woman from Sorrento, near Naples, told me, doctor, give me advice through email, via email. I have a neck uterus cancer. Well, after 2-3 months, she called me. She wrote to me, completely free, cancer-free. Also from Russia, from Australia. Usually, if I can help, even on internet, I do it, if the cancer is simple.
Right.
And the neck uterus cancer is a simple cancer to cure, also the bladder cancer, because with the douching, you can kill the tumor. And with the catheter and infusions with the sodium bicarbonate, 90% bladder cancer, even if it is very big, goes away.
What,
90%.
What about ovarian cancer? I have a good friend of mine. She's usually here, but she's not here today. She has ovarian cancer. Would the douche also work with ovarian cancer, maybe?
No, because it is in the pelvis.
Oh, okay.
If it is a small ovarian cancer, you can try to put the trans-abdominal catheter that reaches the pelvis. You can make flushing. You can flush and fill up the pelvis. If it is too big, and maybe there are some lymph nodes, or there is some spreading, maybe the best thing to do is, before to remove it surgically, only the ovary, but during the operation, sodium bicarbonate or irrigations, and for 1-2 months long, she has to continue. I have people with the recurrence of ovarian cancer. They made the interview. I have, for instance, the last one is from Belgrade, Serbia. She had ovarian cancer relapse, recurrence. There is the interview. And after 2 years, she made the interview cancer-free. It's very difficult, because the recurrence of ovarian cancer kills everybody. But with the sodium bicarbonate, you sterilize, you cook the tumor, the fungus.